At Mass Ave and Cass Boulevard, problems connected with the opioid crisis have recently been getting worse in terms of health, public safety, and quality of life. In response to those problems and growing tensions, Mayor Walsh recently put together a strategic plan called Mass Cass 2.0. To tell us about the plan is the director of the Mayor's Office of Recovery Services, Jennifer Tracey. Thank you very much for being with us, Jennifer.
Sure, thank you.
Jennifer, I want to have you start with the people you're really most trying to help here, who most urgently need the public health attention, people who are struggling with substance abuse. I have a feeling here that they have multiple problems in most cases, don't they?
Sure. As you know, we're in the middle of an opioid epidemic nationally, so cities are feeling the tension as well, and the folks that we're trying to engage and into care and receive services are battling with homelessness issues, mental health, substance use, and poverty.
Start with the engagement. It sounds like a simple word, but how do you engage somebody in a way that really gets traction?
Yeah, it's complicated. We have a full street team now in the Mass Cass area. We had 4 workers that have now increased to 8, in which in the Mass Cass 2.0 plan, we've increased that another 8. So we'll have a team of 16 folks out on the street in all corners, engaging folks and referring them to services in that area and also in other parts of the city.
What about the services they're being referred to? Is that changing in any way in terms of either the amount or the kind of services?
You know, there's more people at the table now. You know, hospitals are very engaged with their front doors. We have community providers who are expanding the breadth of how they serve people. You know, engaging folks into care is one thing, and then keeping them is another. So we have walk-in services down in that area specifically that are open 7 days a week, that are low barrier and low threshold, as we say, to engage people in whatever treatment they may need or whatever resources they may need.
Of course, part of what you're also working with here is you have people who are going to be continuing to use drugs for some period of time, and they're going to think of this intersection and what surrounds it as their home because there's no other option. How do you deal with that?
You know, that's a good point, and it's an important point with the neighborhood and something that we try to balance with our public health strategies, our public safety, and our quality of life strategies, because we do have critical services down in the area. We have a large medical center. We have we have homeless shelters, men's and women's, and real quality services. So it's a balancing act to sort of balance those 3 entities and to keep residents and neighbors feeling engaged and safe themselves, but also engaging folks on the street into the care that we know that they need.
One of the things that intrigued me as part of your plan here is about the role of faith groups maybe providing some sort of a welcoming place where people can get some kind of low threshold attention. What does that mean exactly?
Well, the faith community is a key partner, really, with this epidemic, with the homelessness and the substance use. It's really all hands on deck, and the faith community has always been there for vulnerable clients, and so they're really a key partner. So we look to them to do street outreach themselves. There's a lot of faith-based groups that are out there engaging people and working with us to get people into care or to get people into services, but also to opening their doors. Sometimes a warm cup of coffee, a drink of water in the summer can go a long way.
This is Being the News. We're talking with Jennifer Tracey from the Mayor's Office of Recovery Services. Jen, one of the things that's also been happening in recent years is the rise of fentanyl. It has different effects. There's a different economy involved with that, and it has different consequences for public health. How is the city focusing on that in this plan?
Well, that fentanyl has really been a game changer to the drug using community, to the public safety community. Certainly, it's a synthetic opioid. It goes through your body much quicker than heroin from back in the 70s. And so people are needing to inject more frequently when they're addicted to drugs, which causes a whole host of health issues with wound care and really a whole host of issues. We really need to focus on reducing infection and getting those folks the tools that they need to get safely into treatment.
Now, one trend that we've had for a while are rising complaints about discarded drug needles and I guess rising response from the city. There seems to be more of the rise here, but will this make things markedly different, do you think?
Well, the MassCast 2.0 plan is really investing more resources into not only our team that we have. We in the City of Boston has a Sharps team that responds to constituent complaints and 311 calls across the city, in all neighborhoods across the city, retrieving improperly discarded needles. We've invested more dollars in that team, doubling that team for this additional effort. But we also have our entire staff and outreach team collecting needles. We're working very closely with a lot of coordination across the city with different departments, Department of Public Works, our Parks Department. So everyone has really joined the effort to tackle this epidemic.
And what about police? I mean, who they target and in what way? What's going to change with that now?
You know, well, it's a real balancing act, isn't it, to try to keep public safety at hand and to keep that as a priority as it is for us, and also to keep people engaged. So one of the additions to the plan is the mayor has invested in creating a specialized unit in the police department that will focus on homelessness, mental health, and substance use areas. And these officers are trained in recovery coaching, in mental health engagement, and so they're a real partner now to us.
All right, thank you very much for being with us.
Thank you. My pleasure.
Jen Tracey.